I know of a community health worker
who uses boda riders,
who goes door to door to provide
moonlight services for adolescents and youth in Manyata.
My name is Peter Ngure, a winner of the 120 under 40 next generation of family planning leaders in the country. I work with young people to ensure that they know one extra service provider who can give them services at their point of need. As you understand, young people do not want to access services at the conventional places where they do each and every day. I work with young people to ensure that they know at least one more service provider. People who don't judge them, people who give them the services at the right places, in the young people's convenience. And this is a game changer in the family planning setup in Kenya. I work with a group of 6 or 7 young people who will be going to their communities to talk to health service providers in this project called I Know One Service Provider, Iko in Swahili.
They are the game changers.
They are the game changers. I present to you a new and innovative idea of disrupting the family planning setup in the country and ensuring adolescent and young people can access more services as we move forward. Young people have worked hard to ensure that policies are there, budgets are there, but what is the missing link between having policies and having good budget supporting family planning? The Iko Project, I Know One project, is a project that looks at the other component, which is the service provision. And what we are working with is to encourage service providers to give more services to young people. I know Iko is a Swahili word meaning it is there, he or she can be found. So Iko, a service provider, is an idea aimed at recognizing and awarding healthcare providers who are bold enough to offer family planning services to adolescents and youth, even when it is one of the complex issues in the country, both culturally and from a perspective of policy. Together with a team of 10 adolescents and youth, we are working to identify 7 service providers in 2 counties. That means 1 service provider in each of the sub-county. Despite the young people raising the issue that service providers are the biggest hindrance to them accessing and disrupting the family planning setup, we are working with those who are positively working with young people to access the FP services. The idea is to recognize the bold health workers who are the game changers in family planning, working with them and ensuring that we are indeed changing the family planning setup in the country. The action plan, we will identify health workers who are going out of their way, not their normal working hours, not their normal working spaces, to support adolescent and youth access family planning services in 2 counties in Kenya. We are going to offer them a profile where we can recognize and award them as a way of motivating others to join. And this award should happen during the World Contraception Day. And at the end, we will use the awarded health workers as a mentor to their peers on adolescent and youth so that there is improved family planning access for young people. This is the action plan. Currently, we are developing the action plan as a program lead, working with other young people, as you will see, who are increasingly helping to ensure that these service providers are recognized. The team of young people is the one that will identify the service providers that they feel are working for them. One of the things we've realized is that those who are awarded are the ones identified by the service providers themselves. This game changer is that young people are saying, yes, Iko, a service provider, I know of one service provider who is helping us access these services. We will develop a tool in which we will assess what we mean by youth-friendly services that they are offering, what we mean by they are going out of their way, what we mean by they are the game changers. We will look at things like timing. What time do they offer the services? Do they go to the places where the young people are? Do they talk to the young people friendly and ensure that the young people don't feel victimized? And then during the World Contraception Day in the 2 counties, we will offer the celebration and be able to award this service provider. We believe these are the game changers in our communities. A lot of government service providers fear victimization from their peers and their friends, but we are encouraging them to come out and be bold enough and say, indeed, we can do this for adolescent and youth. We will have evidence of successes for the project. We'll try and see, is there an increased number of health service providers offering services to the youth because they have been motivated by others? Are there a number of bold and courageous service providers who are offering services? And what is the number of adolescents and youth who have started taking up family planning because of these bold health workers? I know of one service provider.
A service provider
who provides family planning services
to adolescents and youths.
They are the game changers.
They are the game changers.